It's really hard right now because I just get so scared to even open my apartment door and leave my house.
I haven't been able to work, and I don't know if, I'm gonna be okay.
Social isolation is a huge problem for many of the families that we're working with, especially families who are already struggling.
We're dealing with a population that sometimes feels like there's no help available to them, or that they're out there and they're by themselves.
Court is basically canceled for everything but dire emergencies. There are no visits between parents and their children.
If parents are expecting to have a child returned, reunified with them, it's not going to happen.
It's really hard trying to speak to lawyers and caseworkers just to get a communication system open on what's going on with the case.
There's also kids that they're homeless right now, because they don't have that connection to their foster parents, or they leave home because they're being abused.
So the situation that's happening now is extremely important that the youth understand and they know without a doubt that CASA will always have their back and that we're always going to be there.
In normal circumstances, CASA is appointed to the cases of children in foster care when judges are concerned that the child is not getting their needs met by the foster care system.
We get assigned to these families to help advocate for them and protect them.
And as the COVID-19 crisis started to really unfold, our team began figuring out how we were going to pivot to virtual advocacy.
The epicenter is now clearly New York, and by tonight, New York State's 19 million residents will be under a stay-at-home order.
Even with everything that has been going on, we're still able to get things done because the youth still need the services, they still need the help, they still need the resources.
We've been helping families access emergency grants, apply for unemployment and SNAP benefits, helping kids who are in school get laptops and internet access so they can do their online schooling, and making sure that kids who've been kicked out of foster homes or college dorms have safe places to live. And then there's just staying in touch.
How are you?
Good, and yourself? My CASA worker, she reaches out to me just to see how I'm doing, just to see how my baby's doing. That means a lot.
The CASA workers, they're doing what they always do. They call us, they text us, they check in with us.
That necessary advocacy piece has not gone away. If anything, it's just become more important because whether that's substance abuse treatment, mental health, stable housing, these systems that were already hard to access have become that much more difficult in a very short period of time.
COVID doesn't stop any progress. It might slow it down a little bit, but it's not stopping anything.
We're still picking up the phone. We're still getting on the computer.
Conference calls, emails, texts, Skype, smoke signals, horse and pony pigeon, carrier pigeon, whatever I have to do to get in touch with somebody, I'm going to do.
This is the job. This is the job.
What CASA is about is finding creative solutions for families to have their needs met and have their kids' needs met.
That support that we need because nobody's showing up like that. Nobody's there like that.
I never had that type of care before having a CASA volunteer. It's like having a family for the first time, having someone that actually cares about you.
I think that's what matters to us the most. Like, you guys show up and you don't have to show up. So it makes you sentimental because you don't have people that genuinely care like that in your life every day,